Hello, everyone. My name is Mike Crane, and I'm an RN at Western Peak Specialty Hospital. This presentation is my policy analysis brief on medical cannabis and its impact on nursing practice. This topic is close to home. Since the beginning of this semester, we've had several patients on our 33-bed LTAC unit using various types of medical cannabis, and each situation has been handled differently. Sometimes the products are taken away and held in the director's office, while other times they're quietly allowed, and even other times they're added to the medication pass with other medications. There's no clear process, and it's very frustrating for the nurses and the patients alike. Today I'll discuss how implementing clear, evidence-based guidelines and education for nurses can improve safety, consistency, and confidence when caring for patients who use medical cannabis. Right now, there isn't a standardized policy guiding nurses in how to assess, document, or educate patients about medical cannabis. Each nurse handles it differently, which can create confusion and safety issues. This inconsistency mirrors what's happening nationally. Nurses are encountering more and more patients using cannabis, but policies and trainings have not caught up. On my unit, I've seen firsthand how the lack of clarity leaves nurses unsure of their responsibilities. It also puts patients in awkward positions, not knowing what's allowed from one shift to the next. The goal of this proposal is to close the gap through policy, education, and structured quality improvement process. Medical cannabis use is becoming increasingly common for chronic pain and symptom management. Research shows it can relieve pain as effectively as opioids, but with fewer side effects and less risk of dependency. Despite this, nurses often report feeling unprepared and uninformed when caring for these patients. Many don't understand the endocannabinoid system or how cannabis interacts with other medications. In my facility, that lack of knowledge has led to inconsistent decisions about storage, administration, and documentation. It's not about whether cannabis should be used, it's about ensuring nurses having the tools and education to manage it safely and confidently. This creates confusion, documentation gaps, and even tension among staff. Evidence shows that this is not unique to my workplace. It's a national nursing issue. The goal is simple: to make sure every nurse feels confident, competent, and consistent when caring for patients who use medical cannabis. This aligns with the American Nurses Association Code of Ethics, which calls on nurses to advocate for patient safety and provide competent, evidence-based care. By developing standardized education and clear procedures, we can reduce confusion, ensure ethical practice, and support both patients and staff. The proposed solution is to integrate national clinical guidelines on medical cannabis into hospital policy. This would include steps for assessment, patient education, safe storage, and documentation in the electronic medical record. It also involves creating an annual competency program so every nurse receives up-to-date education on medical cannabis care. Having a clear, standardized approach would eliminate the uncertainty we currently face, where one nurse confiscates a product while another allows it. Consistency is key for both patient safety and staff confidence. To implement this, I'm using the Plan, Do, Study, Act model. For plan, develop the education modules, update the policy, and create EMR prompts for documentation. For the do, we pilot the new process on a unit over a 90-day period. For study, we track nurse competency scores, documentation accuracy, and any safety incidents or patient complaints. For act, we adjust things based on the results, then expand the policy hospital-wide. This approach allows us to test and refine the process before full implementation, ensuring measurable and sustainable improvement. The key stakeholders include nurse educators, clinical leaders, pharmacists, and hospital administrators. They'll be essential in creating and approving the new policy. Ethically, this aligns with nursing core principles, beneficence, non-maleficence, and respect for patient autonomy. By providing education and clear policy, we're helping nurses protect patients from harm, support safe and legal use, and honor patient rights. Yes, there will be some initial costs, mainly in staff time for training and policy development, but those costs are minimal compared to the potential savings. With fewer safety incidents, clear documentation, and reduced reliance on opioids, hospitals can save money and reduce liability. Once developed, this education can be integrated into annual competencies, making it cost-effective and sustainable long-term. This policy would have a significant impact on both nursing practice and patient safety. Nurses would gain confidence and clarity, reducing stress and confusion. Patients would receive consistent education and care, regardless of who's on shift. It would also improve documentation accuracy and ensure compliance with state and organizational regulations. As someone who's seen the frustration and inconsistencies firsthand, I can confidently say this change would make a real difference in communication, safety, and trust. In summary, this proposal recommends adopting national medical cannabis care guidelines into hospital nursing policy, supported by a structured education program and the PDSA quality improvement process. By implementing this plan, we can strengthen patient safety, reduce confusion, and ensure all nurses feel competent and supported in caring for patients who use medical cannabis. Ultimately, this is about promoting safety, ethical practice, and consistent, compassionate care. Thank you.